Behind these walls, the federal regulator has found workers have inappropriately used restrictive practices to manage falls and the behaviour of aged care residents with disabilities.
It's a human rights tragedy. I think the impact on the individuals is well researched and noted. There should be a zero tolerance of use of restrictive practices.
After an unannounced audit of the Disability SA facility, the Federal Aged Care Quality and Safety Commission reported 9 residents were restricted by lap belts, 5 wore a specialised one-piece suit to prevent undressing, and 10 residents had bed rails in place.
Bed rails are actually a forced seclusion, if you like. You're forcing someone to stay in a bed.
Under federal aged care laws, restrictive practices are only meant to be used as a last resort, following informed consent and after alternative strategies are trialled.
I don't want any service that is run out of our department to not be of the best standard, and to that extent I am sorry that that's happened.
The regulator found restrictive practices were sometimes used because of staff shortages.
Government facilities should definitely know better.
The Minister says the facility's clinical leadership team incorrectly followed NDIS guidelines rather than federal aged care standards around the use of restrictive practices.
I really am working diligently with my department to ensure that our practice, our procedures and the governance is at a much higher level so that this doesn't happen again.
It's not the first time the government has made that promise relating to the care of older, vulnerable South Australians. Almost 10 years ago, the Ogden elder abuse scandal prompted multiple high-level inquiries and led to this aspiration from then Health Minister Peter Malinauskas.
That is to be a national leader when it comes to looking after vulnerable older people who have mental health conditions.
The Human Services Minister says it's not fair to draw comparisons between the Ogden and Northgate facilities.
How can you know for sure that you haven't caused any trauma or any distress to these residents?
Well, we wouldn't know for sure. That is why we absolutely have put in place a change of practice.
The federal regulator first documented its concerns about Northgate after an unannounced site order in November. Staff training was meant to be completed by February, but in late May issues remained, prompting the regulator to put the facility under heightened supervision.
Why has this issue dragged on? Why hasn't it been fixed?
The state government has made no public statements about the failures until being approached by the ABC.
The public doesn't have a right to know?
No, the people that are living at Northgate...
So the public doesn't have a right to know about
The people
this?
that are living at Northgate and all of the people who care about people living at Northgate and our visitors and stakeholders have been advised.
The facility passed other key performance measures, but the regulator has warned of stronger action if the shortcomings aren't fixed soon. Angelique Donnellan, ABC News.